So basically, as we have seen, one can deduce fantastic ideas just from looking at electron microscopic pictures. And as you have seen in the last slide, there are quite a few triads that you can see on this longitudinal section through muscle tissue. But eventually, well, where do I get, okay. But eventually, you may not only want to see structures in a qualitative way, you may want to make measurements from these sections that you have made from your tissue. Under these conditions that you section tissue, three-dimensional objects that, such as mitochondria, become areas. The object surfaces, like the mitochondrial surfaces, become a boundary length, and linear structure become just points. So if you take a section through a 3D structure, essentially what you obtain is a reduction of all the elements by one dimension. And stereology that you can use is the method for extracting quantitative information from these planar section of the material. I would like to make an important point right here, and that is that stereology, normal stereology, always assumes objects to be randomly oriented in space. And you may already know that this is not really the case in muscle. What you do then, once you have your planar section, is you measure the area of an object, or you measure the boundary length within the section. The area you can measure with point counting, and you can count, for instance, capillary length by counting the numbers of intersection of these capillaries with your planar plane. You can also count objects. I will not talk about counting objects like counting mitochondria very much, because that is indeed very, very difficult to do and very time consuming. Stereology is not straightforward in muscle tissue because muscle is highly anisotropic. And as I said, stereology basically assumes structures that should be measured to be isotropically oriented in space. So the problem is that you start to become dependent on the section angle of your section through the muscle tissue with regard to the structure that you want to analyze in quantity. There is a second problem why stereology and quantitative muscle tissue is not straightforward, and that is because muscle is not homogeneous. It has fiber types, and these fiber types can contain very different amounts of quantities, like it can have more or less mitochondria. So you have to make sure that your sampling strategy of your structure accounts for the type of answer you want to generate. Now let's think we want to make a stereological analysis. And the first thing, and maybe the most important thing, is that you have to estimate the reference space. And importantly, you need to know the muscle volume in absolute terms. So you can cut out the muscle and weigh it. That is not always possible, as you know. You can use volume rendering by MRI, or you can make a series of CT scan and use the so-called Cavalieri principle to estimate the volume of the structure that you want to measure. Because if you don't measure the absolute volume of your muscle that you're interested in, you will always end up with relative variables, and you will not know what is going on in absolute terms. The second step is that in most cases, you will be interested, for instance, in what is inside a muscle fiber, like the sarcoplasmic reticulum. So you have to define how much muscle fibers are inside your muscle volume. So you have to define the reference space on the level of the analysis you want to make. And it is becoming quite obvious that this can be a problem because, as you can see in this picture, this is a picture of human muscle tissue after a biopsy. And this is animal tissue fixed by perfusion. And you can see that the interstitial space in biopsies is unreliable because you have differential shrinkage of the interstitial space and the muscle fibers. So there is a problem that you have to solve. Again, I think in many cases, you will have to refer to the muscle fiber volume and estimate how much of your total muscle volume is actually muscle fiber, which can be different, very different, if you're dealing with diseased muscle in particular. Now let's see how we measure, for instance, mitochondria. So how we actually would do that is you count the number of these cross-section points that fall on fiber, total number of points falling on fiber, and relate it to the number of points that fall on mitochondria. Dividing the points of mitochondria by the total number gives you the so-called volume density of mitochondria. For a human skeletal muscle is about 5% mitochondria. So what is the problem of anisotropy here? There is no problem of anisotropy because volume fractions are independent of sectioning angle. So the volume is never a problem to estimate. You can correctly estimate volumes on any kind of a section. And the problem of muscle inhomogeneity, if you're interested in overall muscle data, is solved by using cross sections, because then you have the largest number of fibers on one single section. So you get a good average of muscle tissue. Of course, you can sample within muscle fiber, but that requires you to be able to identify individual fibers at the level you're doing your analysis. There is a problem with these relative versus absolute changes that I would think is important to realize. You can do endurance exercise and you can do strength training. We have heard a lot about that over the last 2 days. If you do endurance training and you measure muscle cross-sectional areas or muscle volume by MRI or any other technique that works, then you will see that in adult humans, male humans at least, muscle volume doesn't change with endurance exercise training. So if you have muscle volume unchanged, the increase in volume density of mitochondria with 6 weeks of training represents the increase of the absolute volume of mitochondria in muscle. So you can see that with an unchanged muscle volume, the relative change of mitochondria is indicative of the absolute change of mitochondria. This is not the case in strength training, because in this particular case, in this, again, a study in which we looked at change in muscle mass, we saw a muscle volume increase by 15%, but the volume density of mitochondria decreased by 15%, which indicates that the absolute volume of mitochondria remained the same from the untrained to the trained stage, but these mitochondria were diluted in a larger myofibrillar space. So the increase is due to the increase in myofibrils. So this is just to show you that you have to be careful and you have to be measuring absolute volumes to go before you go and measure stereological estimates in biopsied tissue. Well, that's a question that I often get. Why do we not just count mitochondrial profiles? You know, you can go 1, 2, 3, 4, 5, 6. These are a little bit bigger, but on average, you could just go and count. Why can't you just do that? You can't do it, and that's from a serial section, because mitochondria in muscle, and this is one mitochondria, the blue one here, and this is the red mitochondria over here. Mitochondria are complex, dynamic 3D structures subject to fission and fusion, and it's absolutely meaningless to count mitochondrial profiles on individual sections. So just forget about that. Estimating anisotropic structures, and that applies now to any kind of anisotropic structure, be it sarcoplasmic reticulum or in particular capillaries. You see, this is a muscle fiber, the arteriole, the venule, the capillaries in between are mostly parallel, like here, but they're a little bit wiggled. Now, if you look at stereology, stereology assumes capillaries to be randomly oriented in space, and to obtain capillary length, you have to use a factor of 2 with which you multiply the number of capillary counts that you see on a cross or longitudinal or whatever section. But if you take a cross section for perfectly oriented capillaries, this factor of 2 disappears, and it's just the number of that you count here. Actually, the number of cross section is directly relevant in this context. So there is a factor of 2 in terms of the error you can make here. What you have to do when you do anisotropic structures, surfaces, and lengths, if this doesn't apply, you don't have isotropy, but you have some anisotropy, you have to do a particular sectioning scheme that is, because your tissue is not sectioned isotropic or is oriented isotropic, you have to make the section isotropic. And you do that in a 2-step procedure where you have a first section where you take an equiangular rotation, and the second section where you have to take a cosine weighted section. And this is due to the fact that you have to compensate for longitude and you have to randomize for latitude. And that is where the cosine comes in. So there is a lot of work involved in sectioning correctly if one makes correct measurements in 3D of structures that are fully or partially anisotropic. Well, assessing capillarity in muscle, it's also something I hear a lot of times is I'm not bothered with stereology, I just count capillaries on cross-section. Fantastic. If you go here and count the number of capillaries, you can get the number of capillaries is 14, because this one is a capillary here, it's a capillary here, here. So there's a total of 14 capillaries. If you do it correctly, then you count the capillaries that intersect with the green line, but you're not allowed to count the number that intersects with the red line. Using the correct counting frame gives you 11 capillaries. So I'm not bothered with stereology, I just count capillaries on cross-section. Is probably not true, between this arrangement and this arrangement of capillaries, there is a factor of 2 of difference that you can see on this planar section. So what I would think you have to assume is whenever you count anything on a section, you are doing stereology and all implicit assumptions hold, unfortunately.
5 minutes left.
Of course, you can do something else. You can use MicroCT. You can demonstrate with MicroCT and microangio filling of the capillary network in a muscle. You can actually demonstrate the capillaries. You could skeletonize these capillaries and you can measure. But then you're not really doing stereology. But there are other ways how you can get at the information that you potentially might want to have. So in conclusion then, stereological techniques allow for unbiased estimation of structural quantities in muscle tissue from tissue section. But in order to obtain absolute structural quantity, the muscle volume must be known, and that is done by weighing or MRI or CT scans. You must define a reference space. Usually the muscle fiber is a good choice for all muscle internal components. The massive anisotropy of muscle tissue must be considered. Also, for volumes, it doesn't matter, but for lengths and surfaces, it does matter indeed, and you need IUR sectioning protocols to obtain correct estimates of structural quantities. The inhomogeneity of muscle fibers may necessitate specific sampling strategies into which I don't want to go. I just remember that any counting on section that you do is per definition stereology and all assumptions hold. So I would advise you to take recommendation to seek advice if you're not used to use it. And annually, we do have a stereology workshop at the Institute of Anatomy. This is this institute up here in the beautiful city. You can see the Alps in the background here in the beautiful city of Bern. And this year, it's going to be in August. And this is a workshop in which the teachers will solve your particular problem. So much just for making a little bit of reclame for our workshop. Thank you very much for your attention.
Well, thank you, Hans. And I think I see we have some minutes for some questions. Are there any questions in the audience?
The audience do not like stereology.
Well, I know most people don't like stereology because it's so much work involved. And in most cases,
it is not well educated, exactly like Hugo is.
The problem is that today you can get your most papers that you want to get published with structural data will get accepted anyway, even if the stereology is wrong. So that's the bottom line.
Well, we use stereology in our EM section. You say we have to worry about the volume, no? That we are analyzing. Is this something we have to worry also on very thin section we use for electron microscopy, which are probably 50 nanometers? Or you worry about stereology when you use thicker section? You worry about the volume when you use thicker section?
Well, that is just an added complication when you have thick sections. But stereology, as soon as you count or measure anything, you're doing stereology and all assumptions hold. And you may get wrong results and you will never know. So it is just my advice. Ask somebody who knows.
I'm gonna have to send some of my people to your workshop, definitely. You have to send me the advertisement.
Thank you. I thank you. But
Absolutely.
Fortunately, Hugo is old enough to do not need stereology at all.
Okay. Okay. Thank you.